Tonight, the pandemic tightening its grip on the U.S. The COVID-19 death toll nearing 141,000. But one glimmer of hope, scientists one step closer to creating a vaccine. Here's ABC's Tom Yamas.
Hi, Grandpa. Hi, sweetie. Here's a big hug.
It's been months since Stella Sexton last hugged her grandparents.
My grandfather turned 93 in June, and I couldn't give him a hug. That was really sad.
To find a solution, she signed up to be part of a brave new army.
Feels like I'm really a part of something big here.
One of thousands volunteering in the human trials for a COVID-19 vaccine.
My grandfather turned 17 on D-Day, and he went out and he enrolled right away into the military. And my grandparents both have a real patriotism, and I have always looked up to them. I feel like it was a patriotic duty a little bit to sign up for this study, because that's what we have to do. Hopefully I'm developing immunity now.
People like Stella are crucial to winning the war against COVID. She says that she is part of a vaccine study at the University of Pennsylvania for a company called Inovio.
I can tell you my personal experience is that my safety has been put at the forefront of this entire process. And when I see the caring and just the professionalism of these researchers, it makes me more confident that not only are we going to have a successful vaccine, but that it is going to be safe.
A global race is underway to develop a vaccine for the coronavirus, which has killed more than 600,000 people, sickened millions, and strangled the world's economy. Finding a vaccine has never been more important here in the U.S., which leads the world in the total number of COVID cases and deaths. This week, 40 states reporting a surge. In some states, officials warn ICUs and hospitals are nearing maximum capacity. Like in Hidalgo County, where Texas patients are waiting up to 10 hours before an initial exam.
In the 30+ years that I've been a physician, I've never seen anything like this before. When you are putting your mom's best friend in a body bag, it's very difficult when you're putting your 6th grade school teacher on a mechanical support.
California had to roll back their reopening, closing down some businesses and beaches just weeks after some had reopened. One family in Southern California representing the virus's devastating toll. 17 family members testing positive, 3 of them died.
COVID's real, and we should take precautions, especially if you know that you're feeling symptoms. Stay home, save lives.
And in Florida, the current epicenter in the U.S., scores of young Floridians still out partying with little regard for social distancing, even as cases climb, and officials warn that there are less than 20% of ICU beds available statewide. Protesters in that state frustrated with Governor DeSantis' response to the pandemic, drowning him out at his news conference today.
If you had been infected,
as he made this plea for plasma.
Your plasma will be able to be used to help other patients.
Florida has reported more than 10,000 cases a day for the past 6 days. And with no signs of the pandemic slowing down, the pressure is on to create an effective vaccine as quickly and as safely as possible.
It's not really a race against other vaccines. It's a race against time.
A new study published in The Lancet finding the experimental Oxford vaccine, one of 23 vaccines currently in human trials, appears safe and activates the immune system to respond to the virus.
We feel that there's urgency and pressure really every day. So people are working day and night, they're working weekends, and we're not going to stop till we get an answer.
The study finding the vaccine produces a double defense. Antibodies that neutralize the virus and prevent it from spreading within the body form within 28 days. And T cells, white blood cells that attack the virus, form within 14 days. Oxford University's COVID vaccine is currently in human trials. More than 1,000 volunteers between 18 to 55 years old are participating.
This vaccine is vital to be able to return to normalcy.
The vaccine, already in phase 3 trials, is on track to be the first to be widely produced. Experts caution that clinical trials for vaccines are in early stages and that much more testing needs to be done before there is proof that any vaccine is safe and effective. While the world waits for a vaccine, Stella Sexton knows she is doing all she can in the battle against COVID-19 and keeping her grandparents safe.
I just feel like when people say, oh, well, COVID is only killing the elderly, I think to myself, my grandfather was here for this country when it needed him, and we have to be here for him now, and anything less is just wrong.
I love you.
For Nightline, Tom Yamas, ABC News, New York.
Our thanks to Tom. And joining us now is Dr. Richard Besser, the former acting director for the CDC and now president and CEO of the Robert Wood Johnson Foundation. So, Dr. Besser, where are we now at this particular moment as far as the search for a vaccine or treatment for COVID-19? And some institutions like Oxford have announced that there are promising results. What exactly does that mean?
I'm very concerned that there's been overhype in terms of where we are on a vaccine. It's amazing the amount of resources, dollars, and effort that are going into developing a vaccine. And it gives me hope that we will get there. But there have been vaccine efforts for other viral infections that in the end haven't panned out. And for this infection, for coronavirus, we're still a long way from having a vaccine that has been proven to be safe and effective.
And as you know, cases here in the U.S. are surging. In some places, local leaders are threatening another lockdown. Would you say that that's what's needed at this moment to beat the virus back down?
I don't think it's the same in all places. There are states that have been able to drive the numbers down. As long as testing can improve so that you're able to quickly identify new cases and do contact tracing and isolation and quarantine, that can be a strategy. But in places where transmission is out of control, where ICUs are full, where hospitals are full, moving to some tighter form of stay at home is going to be the way to go.
Would you say that you're optimistic? I mean, what's the path forward for the U.S. from here?
I can't say that I'm very optimistic right now. And the reason for that is there is this incredible divide still between political messaging and public health messaging. Every public health leader in the nation is saying the same thing, that we're in the early days of this pandemic, and what we do will have a profound impact on how many people get sick and how many die. And on the political side, we're hearing messages all over the board. We need to be unified. It needs to be an American approach to this, not a political approach to this, that gets us doing the things that will really save lives and reduce transmission.
Dr. Richard Besser, as always, thank you so much for your insight.
Thanks very much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.